Hello, my name is Brian Sandroff, and today I'm going to discuss some of the benefits of the effects of exercise. Oh, hold on, restart. All right. Hi, my name is Brian Sandroff, and today in this presentation, I'm going to discuss some benefits of the effects of exercise in people with MS. And today I'm going to discuss a little bit about what we know and where the research is going. So as you know, MS is a common neurological disease that results in profound central nervous system damage. And this damage manifests in the accumulation of both physical and cognitive disability, including but not limited to physiological deconditioning, problems with walking and balance, cognitive impairment, as well as fatigue and depression. Although disease-modifying therapies are effective for reducing relapse rate and stopping the progression of the disease, these treatments are not specifically designed for addressing the symptomatic and functional consequences associated with the disease. This highlights the importance of considering other approaches for managing the functional consequences of MS, and one such approach involves exercise training. So exercise training, defined as repetitive physical activity for improving physical fitness, has been identified as the most effective non-drug related approach for managing the symptoms and functional consequences of the disease. So today I'm going to talk a little bit about how we arrived at that conclusion. And I'll start with what we know about the benefits of exercise in MS. But before I do, I want to discuss safety up front. So historically, neurologists have actually advised patients not to engage in exercise for fear that exercise might trigger relapses or place patients at a greater risk of injuries or adverse events. Well, a group of researchers led by Lara Paludi at the University of Illinois sought to address that issue by performing a systematic review on safety outcomes from exercise trials in MS. And I want to mention that a systematic review is a way to quantify the overall effects of an intervention on in a population by evaluating all of the available evidence. So Dr. Paludi and colleagues examined 26 studies involving a total of nearly 1,300 people with MS and reported that relapse rates were lower actually for exercise conditions relative to control conditions overall. Regarding other adverse events or injuries, the rates between exercise and control conditions were about the same. This led to the conclusion that exercise is a safe intervention that doesn't increase relapse rate or the occurrence of major injuries. So consider that myth busted. Now on to the benefits themselves. So to date, there have been more than 250 papers reporting on multiple benefits of exercise in people with MS, including benefits on physical fitness, mobility, balance, cognition, reductions in fatigue and depressive symptoms, and improvements in quality of life. And you can see that these benefits mirror the consequences of the disease. So, I want to go back for just a second. So what I'm going to do today is go through each of these benefits one by one, but not in a crazy amount of detail in the interest of time. So let's start with physical fitness. A few years back, there was a meta-analysis on the overall effects of exercise on aerobic and muscular fitness in MS, led by Matt Plata, again at the University of Illinois. And also I want to mention that a meta-analysis is another way to quantify the overall effects of an intervention in a population by evaluating all of the available evidence. So Dr. Plata evaluated 20 studies that involved almost 700 people with MS, and reported that the beneficial effects of exercise on aerobic fitness was moderate in magnitude and translated to about an 18% improvement, which is clinically meaningful. By comparison, the researchers reported that the benefits on muscular fitness were a little bit smaller, and those benefits pertain to lower limb strength outcomes, which corresponded to about a 10% improvement. So some limitations that are important to note about the effects of exercise on fitness in MS overall is that not each of the 250 studies included measures of physical fitness as an outcome, as only 20-something were analyzed. And this is a little bit surprising considering that by definition, exercise is physical activity with the goal of improving physical fitness. Also a limitation of the field is that the studies had many different outcome measures of fitness and involved many different exercise programs. So it was difficult to pinpoint what exactly works for improving certain outcomes associated with fitness. But despite these limitations, the authors concluded that exercise is associated with small to moderate sized benefits on fitness that were clinically meaningful. Now on to walking mobility. Mobility problems being one of the most common and debilitating consequences associated with the disease. There have been 2 meta-analyses to date evaluating the effects of exercise on mobility in MS. The first meta-analysis was published in 2009 and reported that exercise was associated with a small beneficial effect on functional mobility outcomes. And these effects were similar for aerobic and resistance exercise training interventions. That meta-analysis also reported that the effects were particularly large for exercise programs that were supervised, that took place in people with relapsing remitting MS compared with unsupervised interventions in progressive MS samples. A few years later, a second meta-analysis analyzed the overall data a little differently. And that group of researchers evaluated the extent to which exercise training exerts clinically meaningful benefits on certain outcomes of walking mobility. And that study reported that yes, exercise was associated with clinically meaningful improvements in walking speed and walking endurance, and it was associated with non-clinically meaningful benefits in other measures of walking speed, endurance, and functional mobility. That's not to say that the effects weren't beneficial, they just didn't reach a certain criterion that was set by the authors. So some limitations in this area is that there are very few studies that have examined the sustainability of exercise training effects on mobility. That is, what happens after people are done with an exercise training intervention? Do mobility outcomes continue to stay the same, or do they get worse over time? We don't know that so well. Also, there have been a general lack of comparisons across the MS mobility disability spectrum, so we don't know if the effects of exercise on mobility are particularly large in people who have mild or moderate or severe MS-related mobility disability. Overall, though, the meta-analyses indicated consistent and small beneficial effects of exercise on mobility outcomes that occur across different types of exercise and across different mobility outcomes. So on to balance. The literature volume for the exercise effects on balance in MS is substantially smaller than the volume of literature on fitness and mobility benefits, as there's only been one meta-analysis and systematic review published to date that was about a decade ago. And that study only analyzed 7 available trials and reported small but statistically significant improvements on balance from exercise training, but those improvements were only in people with mild to moderate MS. Since that meta-analysis was published, there was a randomized controlled trial that was published that I want to bring up because it was a really cool study. That study reported that home-based balance training using a Nintendo Wii balance board system improved balance in people with MS, but it also improved white matter integrity of the cerebellum, which is a brain structure that helps to regulate balance performance. This study was the very first study that indicated evidence for exercise as a neuroplasticity-inducing behavior. And I'll talk about neuroplasticity a little later in this presentation. Some limitations of the overall field is that the methodological quality of the studies were not the greatest. Many involved small sample sizes. And again, there were different balance training interventions from study to study, so it was difficult to provide strong recommendations. But the meta-analysis did indicate small overall benefits of exercise on balance outcomes in MS, and the improvement may be attributable to improvements in structural connectivity of the cerebellum. But again, based on the small overall volume of research, it's a little early to make firm conclusions. So in terms of the effects of exercise on cognition, that's my primary area of research. So I'm going to cover that in a completely separate presentation, and I'm going to move on to fatigue. So as you know, fatigue is one of the most common MS symptoms, and accordingly, it's also the most commonly studied outcome in response to exercise training in persons with MS, as there have been 9 meta-analyses and 1 Cochrane review on the exercise effects on fatigue. So I'm not going to go through each of the meta-analyses that indicate beneficial effects, but I'm just going to make some highlights. So 2 meta-analyses early on reported very similar effects that were about a half a standard deviation in magnitude, which corresponds with moderate-sized reductions in fatigue. The effects from study to study were very consistent. So the fatigue reductions from exercise training were similar from exercise training study to exercise training study. Also, these studies indicated that exercise might be just as effective as education for reducing fatigue. I also want to draw your attention to this Cochrane review, which was a huge a huge study, because it examined 45 published trials in over 2,000 people with MS and reported a similar effect size of about a half a standard deviation, and reported that the effects of exercise on fatigue reduction were larger for aerobic exercise training studies. A very recent meta-analysis that was just published a couple of months ago, I think, actually suggested that perhaps combined exercise might have an even larger effect on fatigue than aerobic exercise. So there's a very, very important limitation in this area that I'd like to discuss, and that is that the studies on fatigue often don't include people with MS who have severe fatigue, which is a problem because the studies essentially aren't recruiting the samples who have the problem that the studies are actually studying. However, one trial recently did include people with MS-related fatigue and reported that aerobic exercise training did reduce fatigue in severely fatigued people with MS, but that improvement was not maintained 6 months after the cessation of the exercise program. In conclusion, overall, there are moderate-sized, consistent, and clinically meaningful beneficial effects of exercise training on fatigue, and those beneficial effects might be even larger for combined exercise training programs. So what about depressive symptoms? There have been 3 meta-analyses on the effects of exercise on depressive symptoms in MS, and the first 2 were very, very similar in scope and reported overall small beneficial effects of exercise on these symptoms. And this was about a third of a standard deviation in magnitude. The third meta-analysis did something a little different, and that study reported that the effects of exercise on depressive symptoms might be particularly large if the intervention was intense enough to meet public health guidelines for physical activity. In addition, a recent review paper hypothesized that exercise training might have even larger effects on depressive symptoms if combined with other approaches for managing these symptoms in MS, like antidepressant medication and psychotherapy. So similar to the research on fatigue, a major limitation in this area is that studies have not included people with MS who have major depressive disorder. This limits our conclusions to only depressive symptoms and not that exercise has an effect on depression proper. In addition, many different studies involve many different exercise programs. So again, difficult to pinpoint exactly what works on what depressive symptom outcomes. But overall, exercise is associated with small reductions in the severity of depressive symptoms in MS, and these benefits are consistent from study to study, but the effects might be even larger if the exercise program is intense enough to meet public health guidelines. On to quality of life. The body of evidence is a little smaller for the effects of exercise on quality of life in MS, and that's evidenced by only 1 meta-analysis and 1 systematic review. The meta-analysis was published 13 years ago and reported small but beneficial effects of exercise on quality of life, with the effects being slightly larger for aerobic exercise training on MS-specific quality of life outcomes. 5 years later, a systematic review had a very different finding, and that review indicated that the current evidence was not sufficient for making strong conclusions on beneficial effects of exercise on quality of life based on mixed evidence. And the reason for that is that there is a debate going on in the literature right now, and that is it really depends on what measure of quality of life is most important for people with MS. Should we be evaluating the effects of exercise on just general quality of life, or MS-specific health-related quality of life, which might have more meaning for patients? So given that there are many different quality of life outcomes that have been used for exercise trials in MS, the overall evidence base is still unclear, where we can't make firm conclusions just yet. But exercise may be associated with a small beneficial improvement in quality of life based on the early meta-analysis. So to summarize, physical exercise is associated with moderate improvements in physical fitness, consistent and small improvements in walking mobility, preliminary and small improvements in balance, moderate reductions in fatigue, small to moderate reductions in severity of depressive symptoms, and conflicting evidence for quality of life. Collectively, this indicates that exercise is associated with multi-systemic benefits in people with MS. There's not one little thing that exercise improves. It has far-reaching benefits, which is really exciting. So the next step is that we know exercise is beneficial, but how do we get people with MS to exercise? Or where do we put the goalposts so that people with MS know how much exercise do I have to do to accrue these benefits? One obstacle that is a pretty big obstacle is it's difficult to design effective exercise programs in MS without having population-specific physical activity guidelines like there are in the general population. Those guidelines were put forth by the US Surgeon General in 2008 for general health benefits and indicate that participating in at least 150 minutes per week of moderate aerobic activity or at least 75 minutes per week of vigorous intensity aerobic activity, in addition to participating in resistance exercise at least twice a week for all major muscle groups, might result in accruing general health benefits. But an important question is this guideline appropriate for general health benefits in people with MS? Well, in 2013, a group of North American researchers sought to answer this question. They published a systematic review for rigorously generating the very first MS-specific guidelines for physical activity. The specific question they sought to address was, what is the minimum dose of exercise that's necessary to elicit beneficial effects on fitness, mobility, fatigue, and quality of life in MS? So that systematic review resulted in a product now known as the Canadian Physical Activity Guidelines for MS. And the guidelines are shown here in this purple box, and I've included a link if you want to access the guidelines themselves as they're publicly available. I also want to note that the Canadian guidelines are not just applicable to Canadians. They're applicable to Americans, Europeans, Australians, really anybody with MS. Well, not just anybody. One of the biggest limitations of the Canadian Physical Activity Guidelines is that the research that went into producing the guidelines were largely based on studies involving persons with mild to moderate MS disability. And these guidelines were not selectively developed for different MS clinical courses or different levels of walking impairment. But last year, a consortium of scientists headed by the National Multiple Sclerosis Society updated the guidelines and published them in Multiple Sclerosis Journal. These are also publicly available. And these guidelines separated guidelines for formal exercise training and lifestyle physical activity. And within exercise training and lifestyle physical activity, organized the guidelines based on level of walking impairment. And I'll show you an example of what these guidelines look like. Really, really detailed, and it separates what people should be doing to accrue public health benefits based on having mild ambulatory impairment, moderate mobility impairment, severe mobility impairment, and even wheelchair users. And these guidelines give very specific examples of what types of exercise to do, how long to do it, how intense the exercise has to be, and what kind of outcomes you might expect. So now that we've gone through what we know about the benefits of exercise in MS, I want to touch on where we're going as a research field, as I think this really could increase what we know and ultimately benefit the lives of people with the disease. So the ultimate goal is to position exercise as medicine for people with MS. And we recently highlighted a few different areas of future research where we can really make an impact to consider exercise as MS medicine. And I'm going to go through these one by one, again, not in a ton of detail in the interest of time. As I mentioned, we know a lot about the beneficial effects of exercise in MS, but we have this issue of how do we get people with MS to engage in exercise. This is especially important because recent data indicate that only 20% of people with MS meet those public health guidelines for physical activity. Well, one way to do so is to implement behavior change interventions in addition to an exercise training program. And these behavior change interventions are important for teaching participants the skills, the knowledge, and strategies to adopt exercise into their own lives. And there are many ongoing lines of research involving behavior change interventions for physical activity and formal exercise training as well, with a couple of very large ongoing studies that are going to be pretty much game changers for getting people with MS active, hopefully so that they can accrue the benefits that we think occur with exercise. The second area is very pertinent given our reliance on Zoom and this presentation even being recorded on Zoom in light of the COVID-19 pandemic, and that is telerehabilitation. Given all the barriers people with MS face to getting to an in-person center to complete supervised exercise training, telerehabilitation might be a really important way to get people with MS to exercise at home, where those barriers associated with transportation or COVID-19 are removed. And there are ongoing large-scale trials right now delivering exercise via telerehabilitation to affect large numbers of people with MS. And this could be really exciting as well, as it's much more convenient to exercise in your home or in the community, as opposed to having to travel to an in-person center. As I mentioned earlier, neuroplasticity is an important area of future research, as we know a lot about the beneficial effects of exercise on the functional consequences of MS, but we don't know a lot about how or why those benefits occur at the brain systems level. In fact, we know very little about the effects of exercise on the brain in people with MS, as we recently completed a systematic review on this and identified only 8 studies that have considered exercise as a true neuroplasticity-inducing behavior. Compare those 8 studies with the 250 plus overall studies, and you have a pretty big disparity. We have some hypotheses as to why exercise might improve functioning in people with MS, but not a lot of actual research to support or refute that hypothesis. But again, I'm aware of several large-scale trials that are actively trying to test this hypothesis to see if functional benefits resulting from exercise are a product of brain changes in people with MS. Another important area for future research involves something called response heterogeneity. And that might sound complicated, but simply put, although we know about generalized benefits of exercise in MS, not every participant who engages in an exercise program experiences the same benefits. If you look at this figure to the right with the 6 panels, this represents individual responses to an exercise training intervention, with bars going up representing positive adaptations on certain outcomes and bars going down associated with worsening. And as you can see, there's a continuum where some people get a little worse, some people don't change, some people improve a little bit, and some people improve a lot. Well, one area of future research that is important is to identify characteristics associated with the different responses to exercise, because we can develop very precise, optimized interventions for certain individuals. And this ultimately could lead to everybody benefiting, which is really what we want. The next issue I mentioned a little bit about with the evidence on fatigue and depressive symptoms, and that is, in general, exercise studies in MS don't involve targeted samples. They recruit people with mild to moderate MS, and these individuals don't have impairment in any one particular issue, and the researchers observe what improves on a number of different outcomes, instead of studying people who have the problem that the researchers are truly interested in studying. It's almost like studying the effects of a headache drug in people who don't have headaches. It's a little puzzling. This puts the research study at risk for ceiling effects, as oftentimes if participants don't have the problem being studied, they don't have a lot of room for improvement with exercise, which underestimates the overall beneficial effects of exercise. It also doesn't allow us to infer that exercise represents a treatment for a certain outcome. But we are actively trying to minimize this issue in the overall research field by creating our trials in such a way that involve targeted samples of people with MS. Another area is combined interventions. So we know that exercise is mostly associated with small to moderate benefits on certain functions, but maybe those benefits could be even larger if combined with other non-exercise interventions like cognitive rehabilitation, for example. I'm fortunate enough to be part of a study called the COGEX study, which examines the combined effects of aerobic exercise training and cognitive rehabilitation for managing cognitive impairment in people with progressive MS versus each approach alone. So it would be very, very, very exciting if the combined approach did result in larger benefits on cognition than each approach alone. Another important area that's been recently highlighted by the International Progressive MS Alliance is that there is a very small body of evidence on exercise effects on functions in people with progressive or severe courses of MS compared to mild to moderate courses of the disease. And this is an area that really needs to improve in the next 5 years. And the good news is I am aware of several research studies internationally that are focusing specifically on people with progressive MS and severe disability. The last issue for future research involves exercise promotion, and this is closely tied to behavior change interventions because we need to really figure out how people with MS can exercise in their own environment and how can they get the information, the skills, and the techniques now in order to adopt exercise into their own lives. We embarked on a line of research several years ago that indicated that people with MS want exercise information from their neurologists. We also polled neurologists who indicated that they feel as if they might not be as well trained as they should be in promoting exercise for their patients. So there's a bit of a gap here. And we're trying to bridge that gap by bringing together MS patients, neurologists, physical therapists, nurse practitioners to be able to promote exercise within comprehensive MS care models in the United States and even beyond the United States. So on that note, also wanted to bring your attention to something that's going on internationally. There is a group of researchers that has embarked on an initiative called the MOXFO initiative that stands for Moving Exercise Research Forward in MS. And this is done to address these areas of future research across the globe. There are researchers from the United States, Canada, Europe, Middle East, Australia that have gotten together to try to benefit people with MS across the world based on what we know so far about the benefits of exercise and where the research field can go. So in summary, exercise is safe and is associated with beneficial effects on multiple MS consequences, with the largest effects being for physical fitness and fatigue. I wanted to note several methodological concerns in the research, and it's important to overcome these concerns for developing better interventions, informing clinical practice, and ultimately benefiting the lives of people with MS. Also, I wanted to note that a take-home point is that meeting the Canadian or NMSS guidelines might result in accruing general health benefits, and future research will examine the effects of exercise on multiple outcomes in people with MS, from the cellular to societal level. So with that, I'd like to thank you for your attention. If you have any questions, here is my email. I'm also relatively new to social media, so here are my Twitter and Instagram handles. Please add me. Thank you.